Hello, this is Liezl Naude from Eloquent Health and Wellness. I am a wound care practitioner in the east of Pretoria at a centre dealing with patients suffering from chronic wounds like diabetes or venous leg ulcers, and we also deal with sports injuries. Today we are going to talk about masks. A few things. Why do we wear masks? What type of masks should we wear? What is the differences between the different masks, and what to do and what not to do when wearing a mask? First things first. Why do we wear masks? We wear masks to protect each other. In South Africa, we've got the principle of Ubuntu. I protect you, you protect me. And the reason for that is that we actually safeguard each other. Now, there are a wide variety of masks on the market, and I want to show you just a few that I could get my hands on. This one is a cloth mask made by one of my patients. It's got 2 layers of fabric with a filter in between as a filter. The material that she used is also water repellent. Quite a nice mask. It's a bit of a thick mask, but it's a very effective mask when you go out in public, or what we use in this clinic where our patients comes into the clinic with these types of masks on. Another mask example is this one, which has got 2 little elastics that goes around your ear. It's made from cotton, very in fashion. And you can also see the shape that it's made. It's made of 3 layers, also with a middle layer to protect you with. A very comfortable mask that you can also use. I would also like to show you 2 other masks. These 2 masks are made from material made by a company who makes sportswear. So it's made from a breathable material that's also water repellent. And because they fuse the layers, you actually have much better protection. It's also a very lightweight mask. This is the first one that I would like to show you. You can see the tiebacks that it's made of, and very similar to the others that I've shown you, make the shape around the nose, making sure that you've got a good fit. Another example from the same company is one that's very similar to what we would see with the doctor's mask specifically, or the surgical mask. This specific mask can be made either in 3 layers, or like the one that I've got here, is actually made of 5 layers. Interestingly enough, even though it's 5 layers, it's a very easy to wear mask and very breathable as well. Okay. This is our cloth mask that I've just showed you, but I'd also like to show you 2 examples of medical masks, or surgical masks that we would call it. This is a mask that I am using quite a lot in my practice. You can see also the elastic bands that goes around our ears, and it can be shaped around your nose in front. There are 2 different ones available. Once again, elastics or the tie-back. These masks are made specifically for the medical fraternity. The reason why we use these type of masks is because we want to have a barrier against any droplet infections or any droplet dispersals. These masks are used for close contact, where we are actually doing procedures and we want to protect ourselves from whatever is being splattered or diffused through the air. These masks are not the same as the N95 mask. The N95 masks are specifically made for healthcare professionals, not the general public. Healthcare professionals who work with patients where droplet dispersion is imminent. Think about your TB patients. Think about patients in ICU, where the risk is so much higher, and procedures in ICU is associated with droplet dispersal. Think about that. If I have to intubate a patient, I am at high risk to get contaminated. And that's the reason why ICU nurses and healthcare professionals working in that environment has to wear the N95 mask. Same goes for TB. It is therefore crucial that we keep those masks for the health professionals who really need it, and not for general use to go out to buy bread. If you want to go out in the general public, your normal mask made of cloth is good enough for you to use. Please leave the N95 masks for the health professionals. Another thing that you need to realize about these type of surgical masks, they are not made actually to be reused again and again and again. They are once-off disposal, and in our practice we normally use 1 mask per patient. But because there's a mask shortage at the moment, globally and in South Africa, we are forced to wear a mask like this for a whole day. And if you don't have masks, in some instances, medical professionals will have to wear the same mask for even up to 5 days where they spray them, get them to dry and reuse them. Just imagine how our skins are looking when you have to reuse a mask, because there's not enough mask for the medical professionals. If you've got masks like this in a storeroom sitting there and collecting dust, please give them to the medical facilities that needs them, the old age homes, our retirement villages, our hospitals, our clinics. We need these masks. You don't. We want to treat you when you're in hospital the right way. If we don't have the right protective gear, we can't. So I've told you everything about the different masks that's available. Okay, and we've got anything from 2 layers up to 5-layer masks that you can use. What I would like to show you next is how to put on your masks. First things first, before you put on your mask, you need to wash your hands. And if you're not in a facility where you can wash your hands, best thing that you can do is use an alcohol hand sanitizer. When I use my hand sanitizer, the same principles apply. In between the fingers, make sure that you interlock your fingernails so that you clean those nails. In between the fingers, on the top of the hands, your thumbs. Make sure in general that you've covered the whole area. Okay. Once I've done this, I can actually take the mask. That's very important. I take the mask by the tie backs. First things first, position the mask over your nose and tie your first tie back. Take the second tie backs and just tie it loosely behind your neck. And remember, your hands have been sanitized, so now you can actually touch your mask. Just make sure that it's fit, nice and snug, and that it's secure over your mouth and your chin. What I like about this mask specifically, it's still breathable, it's very comfortable, and you can wear it the whole day. What happens if I've actually forgot about my mask and I've been touching everywhere? Very easy. Just again, decontaminate your hands, same principle. You go through the same process again, 20 seconds, remember? You need at least 20 seconds to kill bacteria and viruses. Okay. Once you've done that, very easy to take off your mask. Again, don't touch your mask. Start with the bottom one, then with the one on top. And can you see, I'm not touching the mask at all. As you've taken your mask off, whether it's an elastic band or with these tie backs, make sure that you don't touch the front or the inside of the mask, and then you dispose of the mask either in a little bag in order for you to go on and wash it later. So that was the demonstration on how to put on your mask and take your mask off. I would recommend that you at least have 2 masks, one that you've got on during the day if you go out, and when you've taken it off that you've got another one immediately handy. Please remember, how do I take care of my masks? How do I clean it? You can wash the mask with soap and water. If your mask can be ironed, that's even better. But in general, you can just place it in the sun and get it actually sterilized through baking in the sun. Thank you for watching Eloquent Health and Wellness, and thank you for watching me and spending a little bit of time with me with regards to masks. If you want more information, you're welcome to visit our website at www.eloquent.co.za or our Facebook pages at Eloquent Health and Wellness and Eloquent Learning Health. The purpose of this video was just to clarify a few things around masks, specifically in the South African environment. I want to plead with you, don't use the N95 masks. They are made for health professionals. That's going to save your life in ICU and in hospital. If you've got any of those masks available, please donate them to the right facilities. If you have a lot of surgical masks and you've got cupboards full of them, rather either sell them or give them to the hospitals who need them most. If you are just going out to buy bread or do your daily errands, or even if you come to visit us at our clinic, please wear your cloth face mask. If our president can wear a mask and put a mask on, why can't you? Thank you for listening.